clinical conversations on today's Smart Chiropractor Show. Let's get that little overlay up there. There we go. All right. It is April 19th. We're going to revisit an Axis 2021 presentation. As we've said, and we'll say again, stay tuned for information on Axis 2022. And if you're sitting there saying, what the heck is Axis? Axis is the Smart Chiropractor's clinical conference. We hold it annually. 2021 was our kickoff inaugural year. And we had a loaded lineup. We're looking forward to 2022. But over the course of the last couple months on the Smart Chiropractor Show, we've been using our clinical conversation segment to highlight some of the fantastic presentations that were delivered during Axis 2021. And today is no exception. We're going to revisit Dr. Alyson Evans and Dr. Genevieve Newton of Fringe. They talked about, and I always feel like I'm going to butcher this, cannabinoid science. I think I got that correctly. And basically CBD. What's going on in this space? There's so many unanswered questions. You might be sitting there wondering how this can apply to you and your practice. And there's no question that us as natural healthcare providers need to be aware of what's going on. And Fringe is really leading the way with education regarding that. So let's tune in for about 10 minutes to Dr. Alyson and Dr. Genevieve's presentation on cannabinoid science from Axis 2021.
But when I was in school, I became really interested in all things happening on the molecular level, and especially interested in nutrition as well. So I started doing my master's in clinical nutrition as a final year chiropractic student. But when I came back to Canada, I decided to go to Canadian University, got my master's degree, and then I just really got hit by the research bug. So my area of research was nutritional neuroscience. And over the last few years, I've become very personally interested in cannabinoid science. So it didn't translate initially into a professional thing. It was more just dealing with my own health problems and health problems in my family. But then Alyson and I discovered this synergy between our interests, and I've since become the scientific director for Fringe and spend my days now reading all about cannabinoids and being endlessly fascinated by what I'm finding out. So cannabis was really one of, if not the oldest medicinal plant known to man. And we see our earliest records being dated at around 5000 BC, but really the chances are that it extends backwards in time quite a bit further. And if we follow human evolution with cannabis, we can see that it really was just simply a part of life. So it was used as a medicine, it was used as a food, it gave us rope, it was used to make cloth and textiles. And there were many cultures in which it was actually used as a spiritual or religious practice as well. So cannabis for many, many, many years of human history was really just part of human existence. At the start of the 20th century, cannabis was very popular in the US. Farmers were even being incentivized to farm the hemp crops. And if you went to a pharmacy, you would see a number of cannabis-based medicines that were being widely used. But as we got into this century, we see that the cannabis plant became really a public enemy of the US government in the early 1900s. So there was a very aggressive public campaign. It was deeply fraught with racial, political, financial biases. And as a result of this campaign, what ended up happening was that hemp crops were no longer able to be farmed, and cannabis in the form of marijuana. So we start seeing this term now being used literally by governments and as a legal term. It ended up being classified as a Schedule I drug. So in case you don't know what that is, it's a drug that is considered to be highly addictive and harmful, and which has no medicinal uses, which very clearly flies in the face of 5,000 years of recorded history. And for reference, cocaine is classified in the less restrictive Schedule II. So somehow we see that this plant went from really an invaluable crop and invaluable medicine to a dangerous enemy in a few short years. If we fast forward to 2018, we see that there have been many, many decades of intense lobbying by a lot of different groups. And finally, we had a legal bill, the Farm Bill, that removed hemp. And I'm going to get into describing the semantics here because it is a little bit confusing, but hemp specifically, not marijuana, but hemp and its extracts from its list of controlled substances. In 2018, the FDA also approved a pharmaceutical drug called Epidiolex. And Epidiolex is really just a very high dose CBD oil with some other ingredients that is used as a prescription drug for forms of rare pediatric epilepsy. Now, today, what we see is that there are a lot of states and countries where cannabis is either legal medicinally or for both medicinal and recreational use. So once again, we're seeing a resurgence of the use of cannabis as both hemp and marijuana. Again, I'm going to describe those terms shortly, but they're coming back as medicine, as food and textiles like cloth and rope and paper. Public support for cannabis today is quite high, but at the same time, there's still a very powerful government opposition to the use of cannabis, particularly in the United States, where it continues to really be seen as an addictive drug. However, the government views its medicinal potential as being very strong, but more or almost exclusively from the perspective of using cannabis to derive pharmaceutical drugs and to sell cannabis-based medicines as prescription pharmaceuticals. All right, so here I am with my semantics slide. All right, so far I've used 3 terms to describe cannabis. I've talked about the cannabis plant itself as cannabis. I've said that we have hemp and we have marijuana. So let's define what those are. Botanically speaking, both hemp and cannabis are the same plant. The botanical name is Cannabis sativa. Over the last 5,000 years, we've had extensive selective breeding of the plant, such that we really have 2 distinct plant forms at this point. We have marijuana and we have hemp, and they do look very different if you've ever seen pictures of them. So hemp is defined, legally speaking, as cannabis sativa that has less than 0.3% of THC. And in contrast to that, marijuana has more than 0.3% THC, usually quite a bit more. So hemp contains very little THC, but it contains very high levels of CBD, which is cannabidiol. And CBD is non-psychoactive, THC is psychoactive. So hemp is known as the non-psychoactive form of the cannabis plant. Marijuana, containing that higher level of THC, which is psychoactive, is still considered to be a Schedule I drug at the federal level, but we have many states who are now recognizing it as being medicinally useful, and also some states with recreational approval as well. I do want to point out a very kind of strange peculiarity between hemp and marijuana, and that's that while both of them contain CBD, cannabidiol, only CBD that's extracted from hemp is currently legal. CBD that's extracted from marijuana, even though it is technically the same chemical compound, is illegal because the marijuana plant itself is illegal. The reason why cannabis and hemp and marijuana, whichever form you want to be looking at, is considered to be so incredibly useful is because it is absolutely loaded with different chemical compounds. So we have over 500 identified compounds within the plant itself. And the 3 main categories are cannabinoids, terpenes or terpenoids, and flavonoids. So terpenes and flavonoids aren't unique to the cannabis plant. They're found throughout the plant kingdom, whereas cannabinoids are mostly specific to the cannabis plant. Now, recently, some of them have been identified in some of the other plants in the plant kingdom, but not the ones present in really high quantities, not the CBD and the THC. We're talking more about some of the minor cannabinoids, and I'm going to just define those for you very shortly. There are over 120 cannabinoids in the cannabis plant, even though most of them are present in really, really minuscule amounts. And we have many terpenes and flavonoids as well. So the cannabinoids are considered to be the major players in the cannabis plant. The ones that are derived, the cannabinoids that are derived from the cannabis plant are known as phytocannabinoids. And the prefix phyto, we see this in different applications, but it means that the source of these cannabinoids is from plants. So phyto prefix means plants. And this is in contrast to some of the other sources of cannabinoids we're going to talk about shortly. Specifically, we have 2 other forms that are important as well. Or they're forms of cannabinoids. They're the same molecules or similar molecules, but they have different derivations. They have similar activities in the body. So the cannabis plant is made up of many parts. It's got flowers, it has leaves and stems and roots. And if we're looking at where the cannabinoids come from, they are in the highest concentrations in the flowers. And there are also moderate concentrations or kind of lower concentrations in the leaves. So those are our two main plant part sources. And if you look at this picture over here, you can see that there are these really interesting features to the plant. They're called trichomes. So they're hair-like growths that secrete a sticky oil, and that's where the cannabinoids are present. So it's an oil, a sticky resin that's present in these little hair-like projections from the plant. And I don't know about you, but I think they're really very beautiful. So the major cannabinoids, we've got two of them. So THC is one and CBD is the other. And as I've already said, we have THC being found in the highest concentrations in the marijuana form of cannabis, and CBD being found in highest concentrations in the hemp plant. So THC is also, that's the acronym for delta-9 tetrahydrocannabinol. And CBD is cannabidiol. So the reason we call these major cannabinoids is because they're present in high amounts. If we look at their relative concentrations, we see that in marijuana, you can get upwards of about 25% of the cannabinoids being THC. That's really kind of your upper range. And in the hemp plant with CBD, we also see CBD concentrations coming in the 20-some%. Now, I do need to mention though, anybody who has an interest in cannabis science and plant science would have noticed over the years that there's an enormous variation in the THC and CBD concentration of the marijuana plants that are being sold. So even today, we can find a range of THC going down to just over 0.3%, all the way up into the high 20s. And CBD concentration varying as well.
That was Dr. Alyson Evans and Dr. Newton from Axis 2021 talking about cannabinoid science. And this is something that's just taken the world by storm. We have seen CBD products in just about every healthcare and non-healthcare providers, practices and or gas stations around the world over the last few years. And I want to hand it to them and their team for really leading with education and having product behind it. Because as they would well admit, and as we continue to go through that presentation, there's a lot of science that is yet to be sorted out. There are a ton of unanswered questions about how this can help, how it can play a role. And exploring that is something that takes a little guts and certainly is something that I respect and that they've done their due diligence and research. I love that 10 minutes we just highlighted because I didn't know any of that. So to basically get a condensed version of what's occurred in this space over the last 50 to 100 years, great opportunity to learn. Their presentation certainly delivered, and we've had separate conversations with Alyson as a featured guest as well. Jason, take-home messages for or from you.
Yeah, so I just want to make sure people, our watchers or viewers, know that there are 3 reasons why we present these types of presentations. Obviously, this is the Smart Chiropractor show, and some chiropractors may be wondering, are you guys saying that I should be selling these products in my practice? The answer is it's up to you. The 3 reasons why we do this show are, number 1, for you to become a smarter chiropractor. Learning is a good thing. Learning about products that lots of people are talking about. Jeff, your reference to the gas station, and you see signs all over the place, CBD, CBD, CBD. Knowing, having information, being aware of what the conversations that are going on in your community, oftentimes by your patients, is a good thing. So that's number 1. Number 2, you may want to, in fact, recommend these types of products, right? So step 1 is let's learn about them. Step 2 is maybe this could be good for some people sometime. I should know what products are out there and who or where I should refer or recommend my people to go buy these products. That's the second reason. The third reason is, as you'll see as we are launching our Payday Practice program concept, your formula for financial freedom for your future, you will see that there are certain products that are what we refer to as consumables, meaning they take them over and over and over and over again, which means that for some clients, they might be eligible to want to subscribe and save to certain products. And if you can recommend certain products that are consumables that people subscribe and save to, this may be a really smart way for you to serve your patients while also generating monthly recurring revenue. We'll talk about that as time goes on. But our point is not to try to convince you that you should be doing something. It's to make you smarter chiropractors. Some of you are going to learn about it and go, nah, not for me, but I'm glad I know about it. Others, you're going to go, wow, that could be interesting. If anybody asks me about it, I'll send them over to Alyson or Fringe's Way. And others of you may go, wait, I should be recommending that in my practice. What do I need to do? Who do I need to work with? What are the best products that I might be able to offer to my people in some particular way? And there's a variety of ways of doing it, everything from, as we've got the drinkables as they're presenting it. I know some doctors have CBD cream that they use for massages that they offer in their practice, not by the chiro, but by massage therapists. There's a whole wide range of doing these things. Hopefully this stimulated a few ideas for you and also clarified our intentions as to why we bring these topics to you.
Well said. Thank you, Alyson and the Fringe team for contributing to Access 2021. And if docs, you want to learn more, you can search them online. They're pretty darn easy to find. But great topic. Continued exploration. I'm sure we'll continue the conversation. And Jason, thank you for framing it for everybody listening and watching. Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.